Detecting cancer early is an incredibly important goal for both patients and physicians. Colorectal cancer is extremely common. It's the third most commonly diagnosed cancer in men and women in the United States. The American Cancer Society estimates that 152,810 people will be diagnosed with colorectal cancer in 2024. The U.S. Preventive Services Task Force now recommends that patients begin colorectal cancer screening at age 45. As gastroenterologists, we focus on the early detection of colon cancer and other GI malignancies. Our goal is to simplify cancer screening for patients. Here is a brief update about some of the most exciting tests coming down the pipeline. On July 29, 2024, Shield was approved by the FDA. This was a landmark moment as Shield became the first FDA-approved blood test designed to be a primary screening option for colorectal cancer. Shield screens for circulating tumor DNA, or ctDNA, which is released from tumor cells via apoptosis, necrosis, or active release. This is a really cool technology because there are many patients who would prefer a blood-based test over getting a colonoscopy or submitting a stool sample. The Shield ctDNA test had an 83.1% sensitivity for colorectal cancer, but hopefully the technology will continue to improve with a goal of over 90% sensitivity. It should be noted that gastroenterologists prefer colonoscopies for our patients because we are able to prevent colorectal cancer by removing polyps. However, it's always nice to have another screening modality option. The Shield ctDNA screening test is important for patients who are hesitant to have a colonoscopy or to submit a stool sample. If the Shield blood test is positive, patients will still need a diagnostic colonoscopy, just like the FIT and Cologuard stool-based test. Now, there are other companies like Freenome who are also designing blood-based colorectal cancer screening tests. Freenome created the Preempt colorectal cancer study to examine their blood-based cancer screening tests. Some scientists refer to blood-based screening as liquid biopsy. Preempt colorectal cancer was a multi-center registrational study that sought to validate a blood-based multi-omics test for average-risk colorectal cancer screening. The study included participants between the ages of 45 and 85 without a known history of colorectal cancer or colorectal cancer adenomas. The Preempt colorectal cancer study included 200 study sites across urban and rural communities and included more than 40,000 participants across a diverse range of socioeconomic, racial, and ethnic backgrounds. Preempt colorectal cancer screening locations included community hospitals, private clinics, health systems, teaching hospitals, plus tertiary care centers. The study design enlisted the help of organizations like the Colorectal Cancer Alliance and Morehouse School of Medicine. The goal of the Preempt colorectal cancer study was to evaluate Freenome's novel blood test. Using a standard blood draw, the Freenome blood test uses tumor and immune-derived markers, plus machine learning to detect cancer early stages. The Freenome blood test achieved a 94% sensitivity and 94% specificity for early stage 1 and 2 colorectal cancer and AI emerge. The Freenome test pre-specified analysis determined a 79.2% sensitivity for colorectal cancer screening. This helped to detect colorectal cancer by stage with 57.1% for stage 1, 100% for stage 2, 82.4% for stage 3, and 100% for stage 4 disease. Additionally, there was a 91.5% specificity for those with non-advanced colorectal neoplasia. Another blood-based test is the epiprocolon, which seeks to detect the methylated septin-9 or NSEP9 gene. Plasma circulating NSEP9 is derived from tumor-derived apoptotic cells. Epiprocolon received FDA approval for colon cancer screening in average-risk adults older than 50 years in April 2016. The epiprocolon test had a sensitivity of 72.2% and a negative predictive value of 99.8%. Companies are also designing novel new blood tests that can screen for multiple cancers at once. The development of multi-cancer detection tests is important because catching cancer in earlier stages has a major impact on survival rates. Data from the National Cancer Institute has shown that catching cancer early improves overall 5-year survival rates from approximately 20% to 90%. One example is Gallery, Grail's multi-cancer early detection or MCED test that can help detect 5 specific cancers today: lung, breast, cervical, colorectal, and prostate cancers. The company is working on technology to expand to many other cancers. Gallery can detect DNA fragments if they are circulating in the blood. Our learning algorithm is used to determine whether the DNA fragments come from normal cells or cancer cells. The test is able to predict the most likely origin of the cancer, and the Gallery test can find cancers before a patient develops symptoms, helping to identify cancers much earlier. Cancers that grow in the body can shed DNA into the blood. The DNA fragments can act like a fingerprint of the cancer if we try to detect them. According to the Grail website, the Gallery tests use methylation patterns to help distinguish healthy cells from cancerous cells. Methylation is a natural process where methyl groups can be added to a DNA molecule. Importantly, methylation has the ability to, quote, change the activity of a DNA segment without changing the sequence by controlling which sections of the DNA turn on or off, end quote. In general, methylation can turn genes off, while demethylation can turn genes on. Grail uses, according to their website, quote, advanced machine learning algorithms and pattern recognition to read methylation patterns, end quote. The Gallery test has the ability to, one, quote, extract and sequence the DNA fragments from the blood, end quote, in an attempt to, quote, read the methylation patterns, end quote. Number two, try to determine if the DNA fragments are from cancer cells by using machine learning classifier. And three, if the Gallery is able to detect cancerous DNA fragments, Gallery uses pattern recognition to try to determine which organ the DNA fragment is associated with. This is done through a process known as Cancer Signal Origin Prediction, or CSO. It's also important to note that patients who receive the new Gallery test should also continue with guideline-recommended single cancer screening tests, including breast cancer, cervical cancer, colorectal cancer, lung cancer, and prostate cancer, due to the sensitivities of the Gallery test. We don't want patients to have a false sense of security if their Gallery test is negative. The current Gallery sensitivities are low enough that it definitely can miss cancers. However, currently, we don't have a way to screen for many kinds of cancer. So a multi-cancer early detection test can catch malignancy in a fraction of patients. We might be able to improve survival. Exact Sciences, which produces the Cologuard test for colon cancer, has been developing its own blood-based multi-cancer early detection test. Of note, in 2022, Exact Sciences' pre-Ascend study showed that their multi-biomarker class test design improved early-stage sensitivity. In 2024, Exact Sciences shared data from their multi-cancer early detection blood test at the American Association for Cancer Research's annual meeting. Exact Sciences' multi-cancer early detection blood test had a 50.9% sensitivity and a 98.5% specificity across 21 cancer types. Now, several gastroenterological cancers were studied, including colon, rectal, esophageal, liver, bile duct, pancreas, small bowel, and gastric cancers. However, this test is not yet ready for prime time. We need much higher sensitivities, preferably in the 90% and higher range. This data is a promising start, and hopefully this technology can be improved over time. Of note, the sensitivity improved to 63.7% for 6 cancer types with the shortest 5-year survival rate, which includes lung, ovary, pancreas, stomach, esophagus, and liver. This new data focused on 2 biomarkers, methylation and protein, in a multi-center prospective study. Now, the cancer signals are released into the blood via different mechanisms depending on the type of cancer. Physicians and patients should be excited about the prospect of these multi-cancer early detection tests being developed, which could have a major impact on early diagnosis if the test can be improved to increase sensitivities to above 90%. We want to make sure that no cancers are ever missed. Finally, I want to touch on a novel technology that might help gastroenterologists test for colorectal cancer in the future. There is a novel colorectal cancer screening approach which uses VOCs, or volatile organic compounds, which would be a non-invasive way to target biomarkers for colorectal cancer screening. VOCs are the final product of cell metabolism and are excreted in the feces, urine, and saliva, exhaled into the breath, and secreted into the blood. The presence of colonic neoplasia has been associated with changes in the microbiome and cellular metabolism, which could alter VOC production. Increasing knowledge surrounding the detection and classification of VOCs may be useful in screening modalities in the future. This is an incredibly exciting time for the development of cancer screening tests that have the potential to revolutionize our approach. We are celebrating the FDA's approval of the first blood-based colorectal cancer test, SHIELD, and it's promising that other colorectal blood-based tests and the multi-cancer early detection test are coming down the pipeline. A recent commentary by Dr. David Lieberman, chair of the AGA's Colorectal Cancer Workshop, and lead author of an expert commentary on liquid biopsy for colorectal cancer screening and clinical gastrology and hepatology, suggested that, quote, potential benchmarks that industry might use to assess an effective liquid biopsy going forward would be sensitivity for stages 1 to 3 colorectal cancer of greater than 90%, with a sensitivity for advanced adenomas of 40 to 50%. Multi-cancer early detection testing for malignancies other than colorectal cancer is an extremely important development. Patients older than 50 will be especially excited about the prospect of such easy cancer testing, as the average rate of cancer over age 50 is 13 times higher than under the age of 50. Now imagine the opportunity to go to your doctor's office and quickly test for over 12 cancers at a time with a simple blood draw. The future is bright. However, just like the iPhone 1 introduced revolutionary technology, we need time for the technology to improve to achieve higher sensitivities.